Hello friends, welcome back to Complete Medical Coding. Today let's discuss few practice questions from the anatomical session. I think it's been quite long time that we have not discussed some anatomy questions. So because there is no ending for the anatomy part, right? So we have to learn that also in between. So today I'm here with few anatomical questions. So let's move to the questions directly. First question. How many lobes are there in a pair of lungs? In a pair of lungs, how many lobes are there? Okay, there are 5 lobes totally in a pair of lungs. Okay, 3 lobes on the right lung and 2 lobes on the left lung. That is what the answer is. So it is option A. Our lungs are having 5 lobes in a pair of lungs. 5 lobes, 3 lobes on the right lung and 2 lobes on the left lung. Second one, where is Warthin's tumor found? Warthin's tumor, where is it found? Warthin's tumor is found on the salivary gland. Answer is option C. Okay, salivary gland. Third question. The patient is diagnosed with trichomycosis. What does the patient has? Trichomycosis. So you have to know what is trichomycosis. Tricho, the word trich, all these represents hair. Remember that always. So trichomycosis means the fungal infection of the hair. Answer is option B. Okay. Trichomycosis represents fungal infection of the hair. Now fourth one. Which of the following disease occur in the respiratory system? Respiratory system. Endocarditis, tuberculosis, meningitis, diverticulosis. Which one occurs in the respiratory system? Maybe everyone knows. This is tuberculosis. Option B. Okay, tuberculosis is the disease. Among these 4, tuberculosis is the disease that occur in the respiratory system. Fifth question. What do you mean by bilateral salpingo-oophorectomy? This is an important medical terminology. Bilateral salpingo-oophorectomy. Okay. So as you already know from the word, bilateral means 2, both. So what are the options here? This ectomy represents, as you know, removal. Ectomy represents removal. So first option, removal of both ovaries. Removal of both ovaries and both fallopian tubes. Laparoscopic removal of uterus. Removal of both the fallopian tubes. So what do you mean by salpingo-oophorectomy? Since there are 2 medical terminologies, salpingo-oophorectomy. If it is only oophorectomy, it means removal of both the ovaries. Since it is salpingo-oophorectomy, it means removal of both ovaries and both the fallopian tubes. So here answer is option B. Okay. Bilateral salpingo-oophorectomy means removal of both ovaries and both fallopian tubes. And removal of uterus is hysterectomy. Option for the answer for option C is hysterectomy. Now 6th question. What does it mean when the provider documents that the patient has pruritus? What is the meaning for pruritus? Pruritus means itching. Okay. So it's option A, localized or generalized itching. So when the provider documents that the patient has pruritus, it means the patient is having either localized itching or generalized itching. Now 7th question. The documentation states that an incision was made down to bare sclera in the inferior temporal fornix. The lateral rectus muscle was hooked and secured with a double-armed vicryl suture. What anatomical structure is being referred here? So if you read the question carefully, you will get the anatomical structure. Because see, sclera, where is sclera present? Where is lateral rectus muscle present? All these are present in the eye. Okay, so anatomical structure referred here is eye. Answer is option A. Since sclera is part of the eye, lateral rectus muscle is also part of eye. Okay. Now, eighth question. What is the function of a pacemaker? You already know that it is connected to the heart, something related to the heart. But what is the function? Uses the electrical impulses to control the heart rhythm, removes plaque buildup in the coronary arteries, replaces the heart, delivers shocks to the heart only when it stops beating. What is the answer? Pacemaker function. It uses the electrical impulses to control the heart rhythm. It is used to control heart rhythm. So it's option A. Answer is option A. Okay. Uses the electrical impulses to control the heart rhythm. Now, ninth question. A patient is diagnosed with dacryocystitis. Dacryocystitis. What does it mean? Dacryocystitis. Itis represents inflammation. The medical terminology, itis represents inflammation. So what is dacryocystitis means? It means inflammation of the lacrimal sac. Okay. Anyway, in all the options, it is inflammation only. Inflammation of eardrum, inflammation of cornea, inflammation of fingernail, inflammation of lacrimal sac. Here the answer is option D. Dacryocystitis represents inflammation of lacrimal sac. One more question, 10th one. A patient has been diagnosed with meningitis. What does meningitis mean? See, all these words, all these medical terminologies, somehow we are hearing, right? Nowadays. But you have to know the exact meaning, the exact description, or what exactly it is. Okay. So meningitis, it's related to brain. So what are the options? Infection of the ventricles of the heart, swelling of the brain, enlargement of the lymph nodes in the neck, inflammation surrounding the brain and spinal cord. So meningitis represents, answer is option D, inflammation surrounding the brain and spinal cord. Again, meningitis, itis represents inflammation. So meningitis means inflammation surrounding the brain and spinal cord together, both. Okay. So these are few important anatomical medical terminologies, as I had already mentioned earlier. Again, I'll be coming back in between with more anatomical questions. Then compliance and regulatory, all these are also important for the examination. Okay, compliance, you will get questions from, I think, 4 questions from compliance and regulatory. Again, 4 questions from anatomy. So I think 4 or 6, not remembering exactly. I'll come back with the exam pattern also in one episode. You can just stay tuned. Like soon I'll be coming back with the examination pattern, how the examination, because when I wrote the exam, the pattern was entirely different. So now it's changed. So anyway, those who are preparing for the examination, I hope these videos are useful. If you find this video useful, please like and share, and please subscribe to my channel if you are new. And thank you so much for all your support. So stay tuned, friends. Take care. Bye. See you.